I'm going to start by giving you uh, some statistics about staff shortages in UK. In the let me just see if yeah. Okay, in the recent readership survey published in 2022 on the state of general practice, 72% of the participants, which almost 90% of them were doctor, they mentioned that they either have heavier than normal workload or unmanageable workload. And this is more serious if you realize that four of the most important primary care, which is extended hours, early cancer diagnosis, all of them are among of these primary care career. And among of them, for example, workforce shortage varies between 35 to 55%. And for early cancer diagnosis, again, this workforce shortage and uh, backlog of appointment are among of the most important barriers affecting actually NHS to provide service to their patients. Uh, so also this is the same, for example, in United States, in a study by Macquarie and Medical, they says medical error is the leading cause of patient death, and that's mostly associated with the staff heavy load. Delayed deferral, it's actually is another cause of the staff heavy load, and this is more serious for some vulnerable group of patients, for example, migrant and refugee, that they have an English language barriers. This is more serious, and this is also picked up by the recent Health and Social Care Committee report presented in the House of Commons, that they should think about uh, uh, a staff heavy load and find a way that tackle this problem. So in order to address this through NLP, we wanted to see if we can get some data sets, and we realized there is a public data sets about gout flare. If you don't know about gout flare is a sudden and intense attack of pain, redness, and swelling and tenderness in the joint. If you can, mostly it's very common to be observed in toe. Uh, and it's usually triggered by factors such as food, alcohol, dehydration, and other underlying conditions. Therefore, as I mentioned, it has very severe pain. It's very important to be diagnosed and be seen by a doctor. And in addition to this, this is not only a kind of single alone disease. It has high association with cardiovascular threats. It increased risk of cardiovascular disease, including heart attacks. And if I want to be more precise, people with gout flare disease who had a cardiovascular event were much more likely to have had a kind of gout flare event in the 2 months before the cardiovascular threats, and also 2 months before the first gout flare episode. And also it might worsen other risk factor associated with cardiovascular disease such as hypertension, insulin resistant, and obesity. So saying that, how we can detect gout flare detection, this is clinical features that we can use in order to detect or diagnose a gout flare disease. It's quite straightforward if we have this information, text, and the clinical diagnostics test. It's very easy to uh, develop machine learning models actually as a diagnostic tools, and usually it would be very easy to implement with high accuracy. But the problem is in the emergency situation, we don't have this information, and if the patient actually go to the emergency department, usually they follow this kind of healthcare system, and they will record some of the text information in chief complaint, and this chief complaint would be the main source of communication between GPs and patient in the following visit. And also if any other health experts want to learn about gout flare record of the patient, usually they uh, see the chief complaint for that patient and that disease. And if you want to see what is chief complaints note, this is a kind of example of the chief complaint note uh, that reported in the Osborne et al. This is paper published in 2020. And also, fortunately, we were able to get 4 data sets from this text data in the different format. And it was actually the public datasets that I mentioned. So what we did with these datasets, we first developed a feature engineering approach. We extracted n-grams and tested different combination of the n-grams and different feature size. The text in the chief complaints were converted into a sparse representation using TF-IDF, it means term frequency inverse document frequency, and we use linear SVC, support vector machine, as a classifier. We wanted to try these large language models, Roberta, BioElectro, and Bio part for fine tuning, but as you can see, they are very large. For example, uh, uh, this Biomed and PMC, they have over several billion parameters. Therefore, we couldn't actually do fine tuning. Instead, we try LoRa. LoRa means low rank adaptation. They provide us with low rank adaptation, and it's easier to apply this kind of generative AI on the low rank adaptation. And the main idea of the generating low rank adaptation is to increase actually the computational cost. And here is, and in addition, we have used five-fold cross-validation to make sure to optimize performance for the all methods. and uh, uh, the classes that we have used were heavily imbalanced. Therefore, we have used, for example, for the Goat CC 2020, the ratio was this, and for the other one was better. But we have used a class weight and focal loss in order to make the classes balance. And here is the results. This tree at the bottom, actually, this is what reported in the original work by the Osborne, or we call, therefore, we consider this and this one, Roberto Large PMMC, is the one that is, outperformed the others. You can see it has generally a better performance on the both data sets, GOAT CC 2019 and also GOAT CC 20. And after that, it's a bioelectro, but for example, Biomed LM has the lowest accuracy. Uh, so next step we want to do, actually, how we can, for example, one of the important is goat is might be observed in the different location, and therefore the text generated in the chief's complaint would be different. Therefore, how we can generalize the uh, uh, large language models that we have developed to this problem, and also more advanced feature engineering by information extraction. For example, how we can use this information that use is in the original machine language models, how we can benefit from this information. But the main, it was actually just a proof of concept on publicly available data sets. This is something that our NHS partner provided us. This is a kind of just on the one disease, which is that's a record, EHR record that recorded in our NHS center on for ophthalmology setting. Fortunately, we were able, by analyzing very limited number of this data, we were able to quite accurately uh, extract the decision was referral and other type of features that we have highlighted here. We were able actually to extract this information from these letters, which was very promising. For example, here is the results of the our study. For example, BioGPT, the precision is 92%, and F1 score is almost by average is 83%. And in general, we've got very good accuracy on this. However, was only on one disease. Therefore, there would be a lot of variation across these letters for the different disease that we should consider. I believe this was it.